What better way to start a presentation but to show you cute babies, right? And these images are to emphasize I'm a little nervous, I'm sorry. The variety that we see within mammals. But ultimately, we all come from the same place. We're conceived and we grow and develop within our maternal womb or in the womb of our mother. And that development is not possible without the placenta, a transient organ, yes, an organ that is so active with the development of that fetus. It's required for any sort of activity in regard to growth, promotion, and preparation of the mom to eventually produce milk when that individual is born. And this placenta, although so complex, originates from a very thin line of cells, a line of cells that will ultimately interact directly with the endometrium or the internal layer of the mother's uterus. And those cells will start to send out a signal to prepare that maternal environment to allow that embryo to implant and eventually grow and develop. But what's mind-blowing is this embryo is foreign. It is an alien. It does not have the same genetic material as a mother, and so those signals are very important to make sure that that mother, one, allows the development of that fetus, but also doesn't reject it. And so as that fetus knocks on the door of the uterus, if you will, it sends out these signals changing that maternal environment, allowing nutrients and extra blood flow to occur to allow that baby to grow. And ultimately, it's a paradox to think, how is this foreign body, this alien, to actually grow and develop within our bodies? And our immune cells, ultimately, they recognize and survey cells, and when they see things that are different from our own, or they don't express receptors or cellular markers that are so different, that's when we have an immune response, and ultimately leads to rejection or getting rid of that foreign material. But that fetus is somehow able to change the maternal environment and change the maternal immune system by producing products and producing signaling through those products that allow this animal, to develop and to prevent rejection over time. And there are definitely differences between the placenta. Although we are all mammals, we do have some inherent differences. And some of those differences are associated with the layers of the placenta that form. So in this first image, a cow or a sheep, a ruminant, we have 6 layers separating maternal and fetal blood flow. Versus the human or the rodent, there's only 3 layers separating maternal and fetal blood, which ultimately those layers can prevent some immune interactions and prevent any sort of rejection. This is a close-up showing that the human placenta is actually the most invasive of all the placentas. And those fetal cells that are foreign, that are different, actually burrow into the maternal tissues and ultimately steal energy by being bathed in the maternal blood. And yet there is still no immune response. And although sheep, a ruminant, have 6 layers between maternal and fetal circulation, there are cells on a microscopic level that will actually invade and migrate much, much deeper into the tissues than we expect that allow those cells to interact with maternal circulation quite directly. And these close interactions allow for a variety of those fetal signals, those fetal products, to actually circulate in maternal circulation. And we were able to sample those fetal or placental products within the blood of the mothers. And why that's important is because those fetal products that we can find within the mom's blood can actually be used as a non-invasive assessment of how that fetus, how that placenta is doing, versus taking invasive samples, such as taking a sample of the amniotic fluid, for instance, that can lead to abortion itself. We can actually sample the mom's blood and say, yeah, the baby is doing well, or it is not doing so well. And this is the most important thing, because when pregnancies have complications, the products from the fetus or the placenta change over time within maternal circulation. And in our lab, we're most interested in the changes that occur following an infectious disease, especially a viral infection, for instance. And so in our lab, what we're interested in, or why we care, I should say, about that infectious disease is because 2 outcomes can occur. Following a viral infection, we can unfortunately have the worst case scenario where we have fetal death or mortality, or we can have enough damage to the fetus or to the placenta that we have resulting long-term consequences that affect how that baby will survive in their premature phase as well as their adulthood. So in our lab, we investigate primarily livestock diseases. So one virus is BVDV. It's a worldwide disease that's very economically important. And we try to determine, are there any circulating markers or signals from that fetus that will determine how that baby will survive or not survive following that infection. And although we care about livestock, what's really cool about sheep is that the lamb actually develops very similarly to a human fetus. On a microscopic level, the way they exchange nutrients and the way that the brain develops, they're very, very similar. And why I say that is because although we look at BVD, that virus in sheep, it's also very similar to a virus you may have heard of, Zika virus. And both of these viruses are from the same family. They both replicate in a very similar fashion. They're both sexually transmitted, and they both result in fetal disease. And when I say fetal disease, BVDV has, both of these viruses have a proclivity for neural tissue. BVDV in sheep and cattle actually cause brain abnormalities and poor development of the brain, while Zika virus, as you all may know from the news, causes an effect of the brain of human fetuses as they develop, otherwise known as microcephaly. So back in our lab, since we are so used to working with sheep and a virus similar to Zika, we've worked on developing a sheep model to investigate Zika virus and how that affects the maternal-fetal interactions and those products that we can find within maternal circulation over time to see if we can determine how those fetal outcomes, the microcephaly or fetal morbidity or death occur. And why we care about this, although this image may tell you that we're creating a mutant form of sheep, we are not. But these sheep serve as a really good model to, one, understand the mechanism at a cellular level about how that virus gets into that placenta or that fetus, but also how we can better the well-being of livestock and humans overall. Thank you.